name is Amelita Pilapil. I'm a nurse in Valley Hospital in Richwood, New Jersey. I am a clinical shift coordinator in a neurology unit, and today I will tell you what is an epilepsy monitoring unit. Epilepsy Monitoring Unit, or EMU, is a specialized inpatient unit equipped with computer-based monitoring equipment. The goal is to record the typical seizure using a video camera and a continuous electroencephalogram, or EEG monitor, so that the doctor can better treat the seizure disorder and provide a specific medication. The most important thing here, it is a non-invasive process. The monitoring process has two components. First, the video camera, which records all physical activity while patient is on EEG. By video, it types the seizure so that we can exactly see what happened during the episode of seizure, and it tells you where in the brain the seizure happened. Whereas an electroencephalogram monitoring, while in EMU, can detect when seizure occurs even when patient is not aware that it is happening. It gives information about how the brain functions between seizures. It allows to make accurate count of seizures and see whether patient might have more than one type of seizure. What patient to expect during epilepsy monitoring? First of all, patient is admitted in a private room for 3 to 5 days while they are monitored continuously round the clock. We made sure that when patient is on EMU monitor, and in case a seizure episode will happen, that patient is being protected. First, we instructed the patient and family not to get out of bed alone without a nurse or a technician in the room. Second, the 4 side rails will be padded with seizure pads. Third, a patent IV line will be available in case a medication needs to be given during seizure episodes. Fourth, patient will have 2 call buttons, one for the nurse and one is for an event button, just in case patient is having auras before seizure, or if patient is having seizure, the family can use the event button. Fifth, an oxygen tubing will be available inside the room. 6, patient should be wearing a comfortable clothing, or most of the time, patient is wearing our patient's gown. 7, no shower while patient is connected to a monitor, but we can help them wash themselves in the bathroom. And lastly, no smoking. But in case patient is smoking, we can get an order from the doctor for nicotine application. The highlight of this is the application of the electrodes. Patient will lie down on bed while a neurology tech is placing the small, flat metal disc, which we call electrodes, attached to the scalp using a special adhesive. Usually, it takes 30 to 45 minutes for application of those electrodes. For an adult, a total of 27 electrodes, 25 on the head and 2 on the chest, and for a child, a total of 25 electrodes, 23 on the head and 2 on the chest. When all electrodes are applied, the whole head is wrapped with a net and connected to an EMU monitor. The patient and family are being updated by the neurologist daily of what is going on with the monitoring. If no seizure after 72 hours or 3 days, patient is discharged from EMU and then discharged home. But if patient is having seizures or the medication needs to be adjusted, the patient will stay for another 2 days for observation and then discharge home.